Hi everybody, in today's video, my group Kim, Kavitha, Omalara and I, Janine, are going to be talking about the physical changes that occur in the postpartum woman and provide assessment, health teaching, and intervention information helpful for women and their supports, partner, family, or friend.
The postpartum period is approximately 6 weeks following childbirth. This period is often referred to as the fourth trimester of pregnancy. The postpartum woman makes physical and mental adaptations to adjust from being pregnant to the postpartum period. Almost all the body systems are affected after giving birth. Her pulse, blood pressure, and temperature rate may be elevated a few hours after delivery due to pain or excitement. Pregnancy makes changes in your body. Exercise helps a woman's body heal and recover. It helps her feel more energized, sleep better, manage stress more effectively, lose weight, and regain strength in the abdominal muscle. In this slide, we are going to talk about the physical changes experienced by the postpartum woman. There's involution when the uterus returns to its pre-pregnant state by clamping down or contracting. This is measured by assessing fundal height. It roughly descends by 1 centimeter per day and is not palpable by day 10. There are things that can be promote involution like breastfeeding or pitocin, which is just artificial oxytocin given to a mom after delivery. Things that inhibit involution would be a prolonged labor, retained placenta, induced anesthesia, a boggy uterus, full bladder, or forming a blood clot. After giving birth, the mother will experience heavy sweating, hair loss, and stretch marks. She will also experience pains from contractions after delivery from the oxytocin produced, which compresses blood vessels. She will also get backaches and shoulder pains from nursing her baby. Ibuprofen medication can be used to relieve her pain. Her breast will also feel full and heavy. She will lose weight and get back to her pre-pregnant weight in 6 months. Her abdomen after giving birth will be soft and saggy, and she may experience swelling in her extremities.
Also, during postpartum, women are highly coagulable or highly capable of experiencing clots. We need to watch out for clots, and most women are tachycardic postpartum, followed by bradycardia. For her vital signs, her temperature may be slightly elevated for the first 24 hours due to the stress and dehydration in her body. She will also have increased respirations related to pain, and her blood pressure and oxygen level should be within normal range. After giving birth, the woman will feel very hungry, constipated. Having a bowel movement is encouraged within 47 days, and she may get hemorrhoids due to the constipation and also experience voiding retainment or issues. It is important to be aware of the postpartum process for the prenatal woman, postpartum, or even the infant, because this encourages women and their supports, either their partner, family, or friends, to create a plan for timing and schedule of postnatal visits, get adequate information on what to do after giving birth, get the right kind of care at home, and get counseling for their mental and physical well-being for both the mother and their baby, as well as get support and relieve anxiety, depression, or postnatal blues after pregnancy. It is also important to know the benefits of exercise for postpartum women, because exercise helps strengthen and tone her abdominal muscles. It gives a boost of energy and prevent postpartum depression. Exercise also helps promote better sleep and can relieve stress and anxiety, and also let the mom lose extra weight because of the gained weight during pregnancy. The World Health Organization recommends that there should be someone accompanying the mother and the newborn for the first 24 hours after birth, so that someone can respond to any changes of her and her baby's condition. Since there may be many complications that arise after giving birth for the first 24 hours.
What does an effective assessment look like according to the RNO Best Practices Guideline? So for postpartum body change and exercise, we'll be looking at the bubble assessment, which the B means the breast, the U means uterus, the B means bowel, B means bladder, L means lochia, and E means episiotomy. So for the breast, we'll be assessing for swelling, tenderness, and signs of fullness around day 3. And also we'll be making sure that there is no mattices and nipple around the nipples. Also for the uterus, we'll be looking at the fundus. We'll be assessing fundus for firmness, and also we'll be assessing for uterine cramping, and we'll be treating for pain. And we can also teach patients to assess fundus firmness and offer massage in case of a bulgy uterus or excessive bleeding. For bowel, we'll be looking for the vitals for postpartum, most significant after cesarean section, and also we'll be assessing for bowel sound. And for the bladder, we'll be looking for urination and bladder assessment, which are done to check return of urination, which should occur within 6 to 8 hours of delivery. And also we'll be looking out for sign of UTI, which is urinary tract infection. We'll be looking at cloudy urine and bladder spasm. For lochia, we'll be assessing for saturated of the pad in less than an hour, and we'll be checking for the presence of bloody clot that might indicate complication, and also we'll be looking for foul smell, which indicate an infection. While the last one, which is the episiotomy assessment, we'll be looking for red normal episiotomy and laceration, and we'll be also be checking for presence of pain, which might require further assessment and treatment.
Adjusting to motherhood, you really want to take the time to rest, relax, and sleep well when you can. There are after pains, which feels like contractions. They're a normal process as your uterus shrinks back to its normal size. Some women experience constipation after delivery. This may be caused by not moving around so much, medication, or the delivery itself. Try to eat foods high in fiber, including fruits, vegetables, whole grains, and drink plenty of water. To ease any discomfort with hemorrhoids, you can soak in a warm tub or apply chilled witch hazel pads. They're called tucks to the affected area. Proper and consistent peri-care using the peri bottle that you get with warm water every time you use the washroom. If you experience sore, cracked nipples, you can apply pure lanolin cream or breast milk to the nipples as needed. Lanolin cream is available in most drug and department stores. You may experience baby blues, which happens a few days after delivery. This is totally normal. You may encourage to share your feelings with your loved ones, friends, and partner. Try and get some fresh air with some exercise by going for a brisk walk, swimming, yoga, Pilates, a low-impact aerobic workout. It also helps aid the uterus to get back to its pre-pregnancy state. Try to talk with your doctor before any postnatal exercise programs. It's also very important to go to your postpartum checkup. Some symptoms that are not normal and you should contact your doctor and seek help would if you had a high fever more than 100.4, persistent lochia rubra or lochia that has a foul odor, bright red bleeding, particularly if the lochia has changed to serosa or alba, prolonged after pains, pelvic or abdominal pain, or consistent backache, signs of urinary tract infection, pains, redness or tender of the calf, discharge, pain, redness, or separation of any suture line, cesarean, perineal laceration, or episiotomy, and sudden onset of headaches.